Hey, how you guys doing? This is Carrie with Abstract Wellness, and today I'm going to talk to you a little bit about inversion therapy. And this takes place on an inversion table, and I'm on the inversion table right now. And this basically, what an inversion table does is when you're hanging at an angle or totally inverted upside down, it relieves pressure off of your spine, your neck and your spine. And during the day that you're walking about, gravity pulls down your body to the earth, as we all know how gravity works. And your spine, whether you have an issue or not, is basically being pulled down as well. So, people that suffer from sciatic pain, um, different types of neuropathy pain within the spinal region, cervical, thoracic, or whether it's the sacrum, uh, any part of your spine that's being impacted by pain. You have compressed discs or herniated discs that can be in your neck or any part of your spine. That tends to send off signals to your brain that relay as far as pain. And when people bear this pain, it can be very, very detrimental to any health and wellness program that you're following, any workouts or anything like that. Me being a runner, I'm very familiar with this pain. I sought out therapy from a chiropractor, and what they proceeded to do was put me on a machine called IDD. It was an IDD therapy machine, and it was basically a machine that was like a inversion table that pulled me, but it was very expensive. These treatments are not covered by insurance companies. They may pay a certain portion of it if the chiropractor or the doctor names it a certain thing on your insurance paperwork. But other than that, certain therapies such as that do not, fall under healthcare insurance. And you have to come out of pocket for that. And it's very expensive, as I found out. And I also found out that even though this therapy is some sort of an inversion therapy, it didn't work as effectively as I thought it would. So, what I decided to do was purchase an inversion table myself. And you can find some pretty good ones out there. I'm not endorsing any inversion tables in particular, but there are some that are superior than others. They have a few of them out there that, work really, really well, and some of them that don't. One of them in particular is the one that I have. I don't want to give the name because I'm not getting paid by this company, but I don't know if you can see it behind me. It looks like this. I don't want to show the name of it, but this is pretty much how it looks. And what it does, like I said, is there are certain levels where there's a safety harness as well after you strap yourself in, where you're able to set the actual inversion table at an angle and don't go any further until you're ready to fully invert. And this inversion table creates a lot of positive things for the person that's utilizing it. First and foremost, it relieves a lot of the pressure or pain that you're feeling in your neck and in your back because it's decompressing your spine. It's in reverse. So basically, gravity is working in reverse on your body, and it increases your flexibility. It also engages your lymphatic system. Your lymphatic system, as we spoke about before, does not have a pump. So you have to, in addition to you having to do things to activate your lymphatic system, it's kind of hard to do, but this will do it for you. When you invert your body, it will engage your lymphatic system as well. Also, if you're having any headaches, it does a lot of things from a medical and health and wellness standpoint that people deal with every day. And I believe in this. I've been using it as a runner. It's taken the pressure off my back. I feel like I'm able to breathe better as well. Your internal organs also, something happens with your internal organs that's magical when you're inverted upside down. As you start out, you want to start out kind of slow, meaning it's advised that you invert maybe at an angle for maybe 10 to 15 minutes, work yourself up to maybe 30 minutes, and then kind of work yourself up past 30 minutes. And it also depends on your comfort level. Most people do not like hanging by their ankles, and I can show you what I'm talking about here. If you look down there, I don't know if you can see it, but my ankles are fully strapped in and they're snug. So some people don't like hanging upside down and some people don't mind it. I'm fine with it because it's helping me. It's helping me be pain free. I know how I felt, going to the chiropractor, and I'm not saying do not see the chiropractor. I'm saying that there's an alternative to people going and getting treated for something that they can do and control, at home, basically. You could either do this with an inversion table, or if you're at the gym, you can simply hang, and that will also decompress your spine as well. But I feel, it's my opinion, that the inversion table works best because you're inverting your body in an opposite direction for gravity to work on your neck and on your spine. So I'm going to take you guys along for the ride, and we're going right now, laying back nice and comfortable. And now we're about 50%. We're laying flat. As you can see, the floor is behind me. And I just want to show you guys that this is very, very simple. It's very simple. There's nothing to it. Once you get comfortable with the inversion table, you're going to want to use it more and more. It's going to take that pressure off your lower back, off your spine, off your neck, all of that. You're going to be like, Carrie, thank you so much for showing it to me. Some people have known about this for quite some time, and a lot of people don't, because when I mention it to people, they're just like, what is an inversion table? I have no idea what she's talking about. So we're still at 50%. We're right about level. And the way that you move it back, when you set it up, it depends on your height and your weight. So your height and your weight dictate how you're going to be able to maneuver this table as well. And as you can see, we're going back a little bit further. Your arms, your elbows is a part of your weight. So when you want to come up, you move your elbows up to your side. That brings you up. When you want to go back down, kind of move your elbows down. Your feet are strapped in. They don't move. Your elbows are coming up, and you see as your elbows coming up, you see my hand? I'm moving my elbows up. We're going closer to the ground. And now we're upside down. As you can see, the floor is right there. There's the bar. And here I am. We are officially upside down. And now I'm going to fully invert. And what that means is, as you can see, I am fully upside down. And I thought you guys might like that. This is probably the first time you've seen somebody fully inverted. As you can see, there's my ceiling. And I don't know if you guys can see my feet. There's my feet right there. This is also an awesome way to get in your ab work. You can just bring your abs straight up, upside down, come down. Fully engage those abs. Yep, I did it. So if you guys want additional information as to how you can get this in relationship to getting better as far as your spine and getting fully a full spinal workout and decompressing your spine. See, I'm twisting from side to side now. Go on ahead and inbox me. I'll be more than happy to give you the information that you seek. And I look forward to hearing you guys' comments. I'm not crazy. I just want to make sure that you guys are doing all that you can do in relationship to your health and wellness. And again, remember, to know better is to do better. See you guys later. Bye.